Every morning, you stand in front of the mirror. You check your face, maybe adjust your collar, and move on with your day. But what if the reflection staring back at you has been quietly carrying a warning for weeks, maybe months, and you simply didn't know what you were looking at? What if the skin you've lived in your entire life has been sending you urgent signals about your liver, your kidneys, your blood, and everyone around you, including your doctor, assumed it was just aging? Right now, there are 6 changes that can appear on the skin of adults over 65 that should never be dismissed. And the difference between catching them early and finding out too late can be measured in months, sometimes weeks. I'm Dr. Alan Miller, and after 18 years in senior health and wellness, I've seen what works and what silently harms. I've sat across from patients who came to me after months of watching something develop on their skin and assuming it was ordinary. Some of those conversations ended well. Some of them did not. What I'm sharing with you today is exactly what I wish every one of those patients had known beforehand. In the next 15 minutes, I'm going to walk you through 6 specific skin changes, what they look like, what they mean, and exactly what to do if you notice them on yourself or someone you love. I'll be weaving in the stories of real patients, names changed, whose lives turned on the moment someone finally paid attention to their skin. And I need to warn you right now. Sign number 4 surprises almost everyone. Most people dismiss it for years before they find out what it actually signals. Here is something your doctor rarely has 15 minutes to explain. Your skin is not just a barrier between you and the outside world. It is the largest organ in your body, and it is in direct, constant communication with everything beneath it: your liver, your kidneys, your lymphatic system, your blood. When those systems begin to struggle, the skin is often the first place that distress becomes visible. The problem is that most of us have been quietly taught, by years of experience and well-meaning reassurance, to assume that skin changes after 65 are simply part of the aging process. Spots, patches, discoloration, texture changes. We attribute them to the sun, to dryness, to the natural thinning that comes with decades of life. And so we reach for the lotion, we adjust the lighting, and we move on. Meanwhile, the internal alarm keeps sounding, and no one answers it. This is not your fault. It is a gap in the information most of us are given. Let me help close it today. Sign number 1. Sudden yellowing of the skin or the whites of your eyes. Dorothy was 71 years old when her daughter noticed something over breakfast. It wasn't dramatic, just a faint warmth to Dorothy's complexion that hadn't been there the week before. A barely there yellowish tint in the whites of her eyes when the morning light came through the kitchen window. Dorothy had told herself it was the lighting, or perhaps not enough sleep. Her daughter had no medical training, but she insisted Dorothy make an appointment. Within 48 hours, Dorothy had been diagnosed with early-stage gallbladder disease, causing a partial obstruction of her bile duct. She received treatment that same week. That yellowing of the skin and eyes is called jaundice, and it happens when a substance called bilirubin, which your liver normally filters and eliminates, begins accumulating in your bloodstream instead. Bilirubin is a byproduct of the natural breakdown of red blood cells, and under normal circumstances, your liver clears it efficiently. When the liver is under stress, or when the bile duct is blocked, bilirubin backs up, and the first visible sign is that warm yellowish cast to the skin, and especially to the whites of the eyes. In adults over 65, jaundice can signal liver disease, gallbladder obstruction, hepatitis, or in some cases, early pancreatic cancer. It almost never indicates something harmless. If you or someone you love notices this yellowing, look especially at the eyes in natural light. Please do not wait for your next routine appointment. This is a phone call that needs to happen today. Sign number 2. Dark, velvety patches on the back of your neck, your underarms, or your groin. Raymond was 68 years old when he came to see me about what he described as a dirty patch on the back of his neck. He had been scrubbing it in the shower for months, convinced it was a stain or a buildup of dry skin. The patch didn't budge. When I examined it, the skin had a distinctive thickened texture, almost velvety to the touch, and a dark brownish discoloration unlike anything a washcloth could produce. Raymond's wife had assumed it was a tan line. It was not. This condition is called acanthosis nigricans, and it is one of the strongest visual indicators of chronically elevated insulin levels in the body, a condition known as insulin resistance. When blood sugar remains high over long periods, the body begins producing excess insulin to compensate. That excess insulin stimulates the growth of skin cells in certain areas, producing those thickened, darkened patches. In adults over 65, this is a significant warning sign of undiagnosed type 2 diabetes or prediabetes that has been progressing silently, often for years. Raymond's blood work confirmed his blood sugar had been dangerously elevated for an extended period. He began management immediately. The window for reversing insulin resistance is not unlimited, but it exists. And the moment that dark, velvety patch appears is the moment to act. Check the back of your neck, your underarms, and any skin folds. If you see it, request a fasting blood glucose test at your next visit. Better yet, call and ask for one sooner. Stay with me, because what comes next is the sign that sends more people to emergency care than almost anything else on this list. And yet it's the one most people try to treat themselves for months before seeking help. Sign number 3, a wound or sore on your legs or feet that will not heal. Margaret was 73 when she scraped her shin against the edge of a garden tool on a warm afternoon in April. It was a small wound, the kind anyone would clean with soap, cover with a plaster, and forget about in a week. But by July, that scrape had not healed. The edges had darkened. The surrounding skin had taken on a dusky, reddish-brown tone. And Margaret, not wanting to make a fuss, had been applying antibiotic cream and changing the dressing every 2 days, waiting for it to close. When she finally came in, we discovered she had significant peripheral arterial disease, a condition in which the arteries supplying blood to the lower limbs have narrowed, reducing the flow of oxygen-rich blood to the skin, muscle, and tissue of the legs and feet. Without adequate circulation, even a minor break in the skin cannot receive the resources it needs to repair itself. In people with diabetes, the risk is compounded further by nerve damage that can prevent them from feeling the wound worsen. If you have a cut, blister, or sore anywhere on your feet or lower legs that is not closed within 2 to 3 weeks, that is not normal aging. That is your circulatory system waving a red flag. Do not apply another layer of cream and wait another month. Call your doctor, describe the wound, and go in for an examination. Margaret received treatment and avoided what could have become a surgical outcome. The timeline between a non-healing wound and serious complications in older adults can move faster than most people expect. Sign number 4, persistent, intense itching across your body with no visible rash. Howard was 70 years old when he started waking at 2 in the morning, scratching his arms and legs in the dark. His skin looked completely normal in the morning light. No hives, no redness, no rash to explain it. His wife had washed all their bedding with a fragrance-free detergent. They had switched laundry products twice. Howard had tried antihistamines, tried different soaps, tried switching to cotton pajamas. Nothing changed. When Howard finally came to see me, we ran a full metabolic panel. His kidney function had dropped significantly. The itching Howard experienced, called uremic pruritus, was caused by urea and waste metabolites that his kidneys could no longer adequately filter from the blood. These substances accumulate in the bloodstream and deposit into the skin tissue, triggering a relentless itch that no topical treatment can touch, because the problem is not on the skin. It is in the blood. Unexplained generalized itching can also be associated with liver disease, certain lymphomas, thyroid dysfunction, and some blood disorders. The critical phrase here is unexplained, meaning there is no visible rash, no obvious allergic cause, and no response to standard moisturizers or antihistamines. If you have been itching for more than 2 weeks with no clear skin-based explanation, please do not assume it is simply age-related dryness. Ask for blood work. Howard's early intervention gave him years of healthy, well-managed life. The test that found it cost less than a specialist copay. Sign number 5. A sudden cluster of tiny red or purple pinpoint spots that appear on your skin. These spots are called petechiae. They are caused by small blood vessels just beneath the skin breaking open and leaking a tiny amount of blood into the tissue. They look like a cluster of pinprick dots, red, purple, or dark reddish-brown, and they typically appear on the lower legs, feet, or ankles, though they can occur anywhere on the body. There is a simple test you can perform. Press a clear glass firmly against the spots. If they remain visible through the glass rather than blanching white under pressure, what you are looking at is petechiae. George was 66 when he noticed what he thought was a heat rash on the inside of his ankle one evening. By the following morning, the cluster had spread slightly up toward his calf. His wife pressed a glass against it, and the spots held their color. They called their doctor that morning. George had a significant drop in platelet count, the blood components responsible for clotting, triggered by a medication interaction that had not been flagged during his last review. Treatment was immediate and effective. Had he waited another week, the risk profile changes considerably. Petechiae can indicate platelet deficiency, certain infections, autoimmune conditions, blood cancers, or medication reactions. In older adults, this requires same-day medical attention. If you notice these spots, please do not wait for a scheduled appointment. Call your doctor today and describe what you are seeing. Sign number 6. A butterfly-shaped rash across the cheeks and the bridge of the nose. Barbara was 69 when she developed what she assumed was rosacea, a reddish, slightly raised rash that swept symmetrically across both cheeks and the bridge of her nose, like the open wings of a butterfly. She found a new foundation that concealed it well and went on with her life. For 8 months, she treated the surface while the condition progressed beneath it. By the time she finally came in, we found that she had late-onset lupus, an autoimmune condition in which the immune system attacks the body's own tissues, including the skin, joints, kidneys, and cardiovascular system. Late-onset lupus, diagnosed in adults over 50, is increasingly recognized and tends to involve more organ systems by the time it is identified, in part because it is so frequently dismissed as rosacea, sunburn, or age-related skin changes. The butterfly rash of lupus typically worsens with sun exposure, and it is often accompanied by fatigue, joint aches, and a general sense of not feeling well that the person may have been attributing to simply getting older. If you have a symmetrical rash across both cheeks that flares after time in the sun and comes with persistent tiredness or joint discomfort, please show it to your doctor. Cover it with concealer if you need to, but then go and show them what is underneath. Your skin has been with you every day of your life. It has carried you through sun and cold, through years of work and rest, through everything your life has held. And right now, at this stage, it may be carrying the most important message it has ever tried to give you. None of the signs I have described today are automatic death sentences. They are opportunities. They are early warnings, the kind that, when acted on, open the door to treatment, to management, to more healthy years. The patients in these stories who did well, they acted. That is the entire story. They acted while there was still time. Here is exactly what I want you to do this week. First, Take 5 minutes in good lighting to do a skin check. Look at your neck, your underarms, the backs of your legs, and the skin folds on your body. Look at the whites of your eyes in bright natural light. If you have a partner, ask them to look at your back. Second, if you recognize any sign from this video, do not wait for your next scheduled appointment. Call your doctor's office tomorrow and describe what you are seeing. Use the specific language. Tell them the size, the location, how long it has been there, and whether it is changing. Third, if you have any wound on your lower leg or foot that has not healed in 2 to 3 weeks, make an in-person appointment today. Do not send a message through a patient portal. Go in. Fourth, before changing any medication, any supplement, or any skin treatment based on what you have learned today, speak with your physician first. I want to give you knowledge that empowers you, and the best use of that knowledge is always in partnership with your own doctor. As always, please consult your physician before making any changes to your health routine. Now I want to hear from you. Which of these 6 signs have you seen before? On yourself or on someone you love? Leave your answer in the comments below. Your story might be the reason someone else finally picks up the phone and makes that appointment they have been putting off for months. And if you have someone in your life over 65 who should see this video, please share it with them today. You may be doing them the greatest favor of their life. Coming up next, I am going to reveal the 5 common foods that are silently damaging your kidneys after 65, including one that most people consider a health food. You will not want to miss it. I'll see you there.